So my name's David. I've been at Hampden since August last year. I have a background in kind of sports physiotherapy. Worked in at Celtic for 5 years, and then after that worked in the NHS. Was a specialist MSK physio there. So then joined the team last August. And been working here since.
Let us know a little bit about steroid injections.
So steroid injections are a type of treatment that involve basically injecting a corticosteroid into an inflamed or painful joint. They've been used in medical practice for years and can help relieve some symptoms, allow the patient to start the rehab process.
Sure. So what types of injuries can be treated with it?
So you can use it for most inflammatory conditions, so things where pain and inflammation are a big factor. So pretty good for frozen shoulders, bursitis, tendinopathies, golfers, tennis elbows. You can use them for osteoarthritis as well, so if you have pain in the knee, irritation in that respect, then a steroid injection can offer some relief.
Fantastic. And how exactly does it work, and what does it do? What are the benefits?
So what we'd say, it's important to note that a steroid injection is not going to solve the underlying issue, but what it can do is help reduce pain and inflammation. So basically by reducing the inflammation, they help to suppress the body's immune system, settles things down and allows patients to move a bit more freer. Okay, so if pain is a big limiting factor here, you can offer a steroid injection into the desired area, and that will help them be able to move a bit more freer and start the rehab process.
So what exactly is the procedure?
So what will happen, a patient will come in and they'll have a painful area that they're looking to get injected. So we'll sit down, we'll have a subjective examination with them, so we'll highlight what the area is that they're looking to be treated. And then we'll go through a pre-screening questionnaire as such. So this is to gather a history. Is there any sort of past medical history elements that are going to prevent them from getting an injection? So things like if you've got uncontrolled diabetes, if you're on immunosuppressants, things like that, we need to highlight to make sure, is this person safe to get an injection? So once we've done the pre-screening, we will then sit down, have an objective assessment. We'll identify the area that's needing an injection, and then we'll talk over it. So we'll go through risks and any queries that the patient may have, and then once they're fine and they've got all the facts and they know everything, then we'll go ahead with the injection.
Fantastic. And what's the advice post-injection? How soon will one seem to see improvements, and would they need to rest?
So generally we tell patients relative rest for about a week after the injection. It's obviously going to vary from area to area. The kind of bigger joints, we would always advise taking it easy for about 7 days. But usually you'll get good benefit. Hopefully within 24 to 36 hours you'll start to feel some improvements in that time frame. But we do advise that just taking it easy for a week afterwards, just to let things kind of settle down.
For those interested, how do they book?
So best thing to do is just give us a call. Or drop us an email. One of our injection therapists will give you a call back. We will discuss if they're appropriate for the injection, and then we can answer any queries as well if they're looking to go ahead with it.